But I mean, our menu is about exploring mental health crises in the
Yes.
Hispanic and Indigenous Native American populations in the Southwest.
Place matters. Where you live influences how long you live and your quality life and your health outcomes.
Welcome to Profound Conversations.
I am Dr. Mawata Kairi Sankara, and this is Profound Conversations, a place where we engage in the discourse of elevating thought, elevating action, elevating the idea of behavior. How do we change so that we can do better? How do we think better? How do we actually live better? Profound Conversations is not really about being profound. It is the profundity in the content that we uncover with the profound people that we engage with. Today, we're here with Tomas Leon, a person who has been on the vanguard of facilitating change and health issues within a community that has been dispossessed, despised, and it's sometimes disinherited. The actions that he takes is about looking at ways to deal with equality and equity in healthcare, health treatment, and longevity for a population that often finds itself in the crossfires of deciding how to sustain one's life and how to actually have a form of living. We hold that health is not simply about adding years to our life, but it's really about adding life to our years. And this is
Mm,
the work of Thomas Leon. Welcome
beautiful.
to Profound Conversations.
Oh, Dr. Washington, pleasure to be here with you. I've been listening, and certainly an honor to be part of one of your profound conversations here. Thank you for the introduction. I hail to you and from my humble beginnings in a barrio in Tucson, Arizona. Um, Family of eight of us and growing up in an 800 square foot house. Certainly trying to make ends meet. So a lot of my work, actually not a lot of my work, all of my work is centered and grounded on my humble beginning and my roots. Um, and we had to overcome a lot. We know what it is to try to keep your lights on and make the most out of a food box and not easy access to healthcare services or transportation to get around. And I was the first in my family to graduate from college and earn an advanced degree. And so, that centers my work and that's what drives my work. That fuels my passion to making sure that everything I do with other public-private partners, and everything I do is to try to create greater access to health and well-being for everyone. But we all know that there's diverse, underserved communities that have a lot of barriers, and
Mm.
so that's where I lean into this work and try to create more fair and equitable access to the resources that people need to achieve optimal health and well-being. And so I was a young teen parent growing up myself, and I have, two boys, two girls. My youngest is 18, my oldest is 39. I have
Mm.
I'm a grandparent, three grandkids. So, I started early, I finished late having kids, and that also centers my work, right? So before we're any titles, we're about being a grandparent, a father, a friend, a spouse or a partner. And so I really try to center myself and keep myself grounded in that humble beginning. My
Go ahead.
mother, she introduced me to work in the community. She was a nutrition educator and worked in the Old Pascua community and the Hispanic community teaching nutrition education. And so she's the one that introduced me to a heart of service in the community, and as well as my father, late father. He served in World War II and became a lifelong blood donor. So they, even though they were elementary educated, humble beginnings, they still did everything did to serve others and to serve the community.
That's actually where we find our greatest level of health, right? Is in this act of altruism, where we can give to others.
Yes.
That it's been clearly shown that people who do that actually, again, have a greater quality of life than those
That's
who
right.
are, really stuck in, I guess, woe is me syndrome. You
Yeah.
have taken your experiences, right? What you grew up with, and how you have had these life encounters, and you've turned it into a life vocation,
Yes.
and that is admirable. And then you pass on the generational knowledge, right? The
Yeah.
generational affect, the generational process by which you give to others. Now, we want to today explore so much. I mean, there's so many things happening, but I mean, our menu is about exploring mental health crisis in the
Yes.
Hispanic and Indigenous Native American populations in the Southwest. So, what do you see as this challenge in this moment, right? That populations are not receiving the resources that they need. What is it that we need to think about deeply, that we can begin to do to impact change? How do you see your work actually impacting change at this time?
Yeah. I look at my work through a framework of healthy communities. So at Equality Health Foundation, our vision is, and what really inspires me. Um, and by the way, if you're passionate about what you do, you never work a day in your life. And I'm very blessed and very fortunate to be leading Equality Health Foundation with a vision of an inclusive society of healthy communities where every person, you and I and our loved ones, can achieve optimal health and well-being. That's a world I want to live in. That's a beautiful world, and it's achievable. It's attainable. We have the power and the potential to make that happen. But we know that diverse, underserved communities have a lot of barriers and challenges. There's not a level playing field. There's a lot of barriers. There's no fair access to health, to resources to achieve optimal health and well-being. And so our mission is to level the playing field and remove those barriers. And so that really inspires and drives our work. And we look at our work through a framework of policy, people, and places strategies.
Mm-hmm.
All of what impacts a person's health and well-being, or their ability to achieve optimal health and well-being. And so, place matters. Where you live influences how long you live, and your quality of life, and your health outcomes. So that brings you to your state, that brings you to your city, that brings you to your county, that brings you down into your neighborhood and your zip code.
Right. There you
And
go.
so,
You hit it. You're right there. The zip code research, the zip code access. Let's talk about that. Let's go there. We're gonna pull back from that. But that's one of your pride projects right now. This
yeah.
idea of the zip code access discourse. Talk about it. Let's talk about that.
Yeah, you're kind of tying it to how you started this
Yeah,
conversation, in terms of what's happening right now in this country, with the all the policy decisions that are being made, and how that's going to impact millions of people all across the country.
indeed.
So we began our well-being transformation work um, after the pandemic, because what we saw, we were leading the pandemic response with our public-private partners in Arizona for vulnerable populations, diverse communities. And so, because as you know, the pandemic really had a disproportionate impact on the Black and Hispanic community. It actually added 3 years of loss of life to that population. And in some cases, um, Black and Hispanic uh, communities were already experiencing a 14 to 17-year life expectancy disparity gap. And in Arizona, that exists between South Phoenix and North Scottsdale, more affluential part of our community, just miles apart. So, if you grow up in South Phoenix, you're going to die 14 years earlier than someone in North Scottsdale. And then you add another 3 years of loss of life because of the pandemic impact on our community. And so we decided we were going to focus on what we can do to support a well-being transformation initiative to help the healing and the recovery and the preparedness for that community to address those health disparities, those systemic and institutional issues and challenges that, you know, connect with policy and people and places strategies. And so the zip code exam project was born from that experience that we have had in the last 2 years doing an assessment and getting ready to activate a coalition to implement some strategies over the next 5 years. And so that's where the idea of the zip code exam project came up, where we wanted to democratize data available to people in any zip code across the country so that they can understand what their community health report looks like. You know, oftentimes people, when you think of your health and well-being, well, let's go to the doctor and the stethoscope, they'll check your heart and do all that stuff. Well, the zip code exam moves beyond that. It's like, let's check the health of and well-being of your community, and let's start there. You know, to understand what's going on in your neighborhood that's impacting your health and well-being and your longevity.
I know you throw out terms, right? You threw out this well-being transformation initiative. You got to explain that. Then we're going to back up to the zip code exam, right? And then we're going to back up to the SNAP conversation. So what is well-being transformation initiative?
Yeah.
What is that?
That's so when we think of health, right? Sometimes we just think of physical health. And so when the work we do is we take a whole person care approach, looking at the whole person, not just the physical health, but the mental health and the social support, the social well-being of that person. So well-being is inclusive of that whole person, right? So sometimes people just think of health and healthcare, it's health insurance coverage or access to quality care. That's very important, but that's only 20% of what impacts your health and well-being and my health and well-being. 80% or more are what we call the social determinants of health that impact your health: housing, education, employment, your built environment, you know, access to healthy foods, your, you know, mobility in your community. That is going to impact your overall well-being. That includes physical health, mental health, happiness, your quality of life. So we got to look at this holistically, you know, as we look at transforming and modernizing our healthcare delivery system or our healthcare system. We have to take a more holistic view, a whole person care view of how we are addressing health disparities in the health and well-being of people and communities.
You know, in order for that to happen, you have to see a person as being human, right? And so in this this current climate of managed healthcare, people are just seen as an opportunity to get earnings, right? So people have their niche. The medical doctor does this, the psychiatrist does this, the psychologist does this. So everybody's just doing their thing and pushing people through like a warehouse. But you said, right, the whole person. And that this idea of whole person well-being deals with the whole person. That is seeing a person as human.
Yes.
Very powerful process. And so that shifts everything, because you also mentioned that this idea of policy, where I live, is also driven or influenced by policy. So with this zip code conversation, you talk about the issue of longevity, health disparities, and zip code. That's important because there are two reasons generally why I make a decision to live where I live. One is economics, and two deals with the socialization process, who I feel comfortable with. And many times there's a intersectionality of the two, because I am often have an affinity for people that I have something in common with.
Yes.
And so that influences things, but also that begins to influence other things, other activities that I engage in. So I'm really liking this idea of the zip code access and recognizing that zip code does mean a lot. And I will share this with you as well as we go into advancing health and well-being. There was a research study that was done when I was in San Francisco about zip code and longevity. And what was really interesting about this was that it found that Blacks and Hispanics that lived in affluent zip codes had a lower life expectancy, or as equal to whites who lived in a more impoverished zip code, right? So it means that there's something else happening there as well.
Yes.
And this is where your well-being, your health comes in. It's not just about where you live, but it's about the conditions under which you live. And so on your website, Equality Health
That's
Foundation,
right.
it says that Hispanics are about 50% more likely to die from diabetes than Hispanic whites. You also say on the same website that African Americans are 40% have greater risk than whites of having high blood pressure and thus having concerns around heart disease, kidney failure, and a stroke. It's imperative to understand that racism influences both of those things. That cortisol level raises when one is trying to survive the horrific dynamics of racism and oppression, and that then causes plaque to build up in the arteries, which causes coronary heart disease. And then you talk about the issue of metabolism and how we metabolize carbohydrates and tied to diabetes. This is important, not just simply about zip code, but about the conditions around which the zip code becomes the area that we live in and the conditions that we have to live under. And then I would add to that, in these various zip codes are food deserts, right? So this idea of environmental racism. And so I'm turning it back over to you. I threw all that out there to make sure that it was part of the conversation, because you have to go to look at this Equity Health Foundation website, and it's chock full of content, information. And this past summer, I had a multicultural class, and we engaged in doing the zip code assessment. And so they were looking at dynamics of lifestyle longevity in their zip codes, and they were amazed when they started looking at where they lived in parts of their particular community and the differences there. So let us go back to the zip code conversation, right? And you all say that we believe that a zip code should not determine how long or how well we live. Speak on that.
Absolutely. Dr. Washington, thank you for adding that rich, colorful context, because you can't just look at the data, right? Data is important, and we wanted to democratize data so that anybody in the 30,000 zip codes across the country can put your zip code in there. You get what your projected life expectancy is, and then we did a rating on 5 domains, so that gives you your community health report. Those aren't the only factors, but that are impacting you. But there's some pretty influential, or what we call the hidden forces in a community that are impacting your health and well-being, your longevity. And so, but we have to add context to the data to bring the story alive of the person that's living in that community. And so you talked about racism and discrimination, right? So when that exists in a community, that adds to stress and anxiety, and it impacts your mental health and your well-being and your physical being as well. And so that shortens your life expectancy, and that impacts your quality of life. So when people are feeling isolated and lonely or scared or in fear, then that is having a detrimental impact on that person's physical, mental, and social well-being, their whole, their whole well-being. And so, we have to pay attention to that. So when you're working in communities and you're working with local residents and public-private partners where there's a historical systemic racism and discrimination that's taken place, you have to pay attention to that. You can't ignore that reality for the members of that community. And so, that is important context. And that's why, if you interact with the zipcodeexam.com platform, it's a starting point. We're trying to make some publicly available data that we've aggregated, and we present it in a way that can help you have a profound conversation with your local community or within your family. Or and we made it easy for you to email your elected officials the report.
Oh, wow.
So that you can make them aware of what's going on, and hold your elected officials, who are the policymakers, decision makers that allocate resources and make policies that are going to help or hurt people, to be able to do something about it. So that's where we're giving power back to people and making data available to begin building awareness and having profound conversations. And then we need to go to activating grassroots action and solutions,
Yes.
right? And
Yes.
so that was the intent of this interactive platform, is to uncover these hidden forces and put powerful data into the hands of people to do something about it, to activate their local community or within their family, to see what can we do. So, for example, you touched on food insecurity and a food desert. So in South Phoenix, it's both a food desert and a food swamp, right? So there's and the residents, when we shared the assessment data we conducted, they're the ones identified as like, we're living in a swamp. We don't want another fast food restaurant in our neighborhood. It's cheap and easy and unhealthy for you, and we want better. We want healthier options. We want a grocery store within walking distance that's you can get affordable fruits, vegetable, grains, and nuts and herbs. We want restaurants offering more healthier options. And so we're working with the local coalition there to address the food desert and the food swamps to create greater access to healthy foods for people, so that they can achieve their personal goals or their family goal or their neighborhood goal of, hey, we want to live longer lives. We want to live a more quality life. We want to live a healthier life.
Food swamp. That's a whole nother piece, right? What is there, right? Garbage is in the space, which
Yes.
also shortens our lifespan because of our food intake. Because we don't recognize that food really is about enhancing the body to function at an optimal level. And you've used that word several times over
Yeah.
about optimal health, right?
Yeah.
Optimal health, right? How do we live optimally, right? Because we can just survive, but when you start addressing these inequities, right? We start addressing what's not there. And when you begin to address the dynamics of how that influences how we live, and then you influence what's there, right? People die more from what's eating them than from what they're eating. That's the systemic racism and oppression, right? And then you give agency to them by saying that if you go to this site, we give you a way to connect with the policy makers so that you can tell them and inform them how to impact change. The idea of agency also begins to enhance the quality of life, because not only do I have to suffer via learned helplessness, but now I know how I can activate change, which means now that I'm an agent of change, which also means that I'm living for something greater than myself, right? And so I love it. How can we engage in the zip code exam? You gave it to us quickly. I want to hear it again. Zipcodeexam.com. What is so some
Yeah,
people
you
can do
go
it.
to type in zipcodeexam.com, put in your zip code, and it's going to give you your projected life expectancy and a rating on different health domains around housing, affordable housing, education, as well as walkability in your community, workforce, access to healthy food, your health ecosystem. And it'll give you a rating from 0 to 100, 100 being the best, 0 not being so well. And then you can even compare your zip code to another zip code. And
Mhm.
so that way you can see what the differences are between your zip code and another zip code, either close by or in another community. And so again, and then we're building out a take action section. The more we hear about solutions and resources, we're starting to build that out. So we're pointing people to potential solutions. But even if we do that, the solutions lie within the community.
Yes.
That's where action is going to happen. And there's some innovation that's taking place in communities that need to be supported and watered and grown. There's some best practices that people can adopt from other communities in terms of policy, people and places strategies that can accelerate transformation in that community. But more importantly, a community needs to come together in an alliance or a coalition to affect some broader transformation in that community. And that's what we're attempting to do, is working with an emerging coalition in South Central Phoenix. Soon we're working on developing a toolkit so that people can download from the website, so we can give them a framework and a process by which we've taken taken that on, and hopefully it provides some guidance for people. And so we're just going to continue developing resources based on feedback. We're getting calls from Queens, New York, emails from different parts of the community, and LA and Texas and other places who are interacting with with the platform and using it to activate change and build awareness in their community. So yeah, I mean, it's important to go to your doctor. You need to know what your physical health status, your mental health status is.
Yes.
But get your zip code exam done too, so that you know what's going on in your neighborhood, so that you can do something about it.
That's the jewel, right? I think uh, the zip code exam gives us an opportunity to see what's happening and then begin to take action. And like, we know that something's happening, we feel something's happening, but then this shows us like this, it's really real.
Thank you for joining our profound conversation. If you found this episode helpful, please subscribe to our podcast and then gift this information to a friend or family member using the share button.